I want to talk about the overlap between being neurodivergent, so autistic, ADHD, or other, from a psychotherapist perspective. When we think about trauma, most people imagine a singular catastrophic event. Trauma can also stem from, very often, years of subtle, consistent invalidation, being misunderstood, dismissed, or feeling like you don't belong. For many neurodivergent adults, particularly those late diagnosed, this is their reality. So let's talk about the overlap between neurodivergency and trauma and what that means for many people's story. Research tells us that neurodivergent individuals, whether autistic, ADHD or otherwise, are 2 to 3 times more likely to experience chronic stress and trauma than neurotypical individuals. One reason for this is in the way that the world is designed. Most of our systems, education, workplaces, and even in our social norms are all built with neurotypical brains in mind. If you're neurodivergent, you often feel out of sync, like you are failing at something that was never actually meant to accommodate. Think about it. Imagine being constantly told that you are too much, you're too sensitive, you are not trying hard enough, or worse, imagine being overlooked entirely, with people assuming that your challenges are laziness, lack of discipline, or just a lack of ability. Over time, this isn't just going to be frustrating, it's going to actually become traumatizing. It creates a deep wound, a deep sense of identity that is not actually based in truth. It creates a deep sense of shame and self-doubt. For those diagnosed late in life, there's often this moment of relief where you finally have the answer. I'm not broken. I never was broken. But after the relief, it is quickly followed by some level of grief. Grief for the years that you lost, for the struggles that could have been easy if only you'd known, or if only other people would have understood. And then there's the anger. Anger at the systems that failed to recognise you, the people that dismissed your needs, and the endless advice of just try hard. This cocktail of emotions can feel completely overwhelming. And when many of us are already heading towards burnout and regression quickly follows. Here is what many people don't realise. The trauma of being misunderstood doesn't just sit in your mind. It also lives in your body. It shapes how you see yourself and how you react to the world. It completely changes your worldview. It affects how you trust, how you connect with others, even how you pursue joy, or whether you even think that joy is possible for you. Now let's talk about one of the most common experiences for neurodivergent people, social rejection. Whether it's subtle microaggressions or outright exclusion, repeated rejection leaves scars. Fact. It literally changes the wiring of your brain. It changes your deep internal beliefs. And for many, this develops into something called rejection sensitivity dysphoria, or RSD. This isn't just being overly sensitive. It's a deeply painful emotional response to feeling misunderstood or excluded all of your life, and it often is rooted in past trauma. What makes this even harder is the cycle that it creates. You become so fearful of rejection that you shrink yourself, you mask your true self to try and fit in, which only deepens the wound and deepens the feeling that you're not good enough as you are. Many neurodivergent people, especially those late diagnosed, spend years being told that they're dealing with something else. Often depression, anxiety, autoimmune disorders, even personality disorders. And I'm not saying that those things all aren't singular and you can be struggling with those, but often there's so much comorbidity. These labels, sometimes they're true, often miss the bigger picture. When your neurodivergency isn't understood, treatment can feel like trying to fix something that isn't broken. You end up internalizing the message that I'm too difficult, even for these professionals. They don't seem to be able to fix me, but they can fix other people. This can lead to a mistrust in the very systems that are supposed to be there to help us. The good news is, understanding your neurodivergency can be incredibly healing. It's like not being able to see all your life and then getting a pair of glasses, as long as you get the right prescription. It's like finding that missing puzzle piece that finally makes the picture clear. Like if you have watched Catchphrase, that final piece that gets revealed. It's about realising that their shutdowns were something much more than that, or that their meltdowns weren't overreactions, but a response to sensory overwhelm, or that their inability to focus was actually their brain wired for hyperfocus on what truly matters to them. It's a radical reframe. It helps encourage radical accountability, radical self-acceptance. Instead of seeing yourself as flawed, you begin to see yourself as neurodivergent, and that neurodivergency is valid and it's a unique way of experiencing the world. If you're living through this pain of being misunderstood, you're not alone. The overlap between being neurodivergent and trauma is so real, and that is from a psychotherapist who predominantly works with people who are neurodivergent and also have trauma. So it is absolutely possible to heal. Understanding yourself, your brain, and your needs isn't just freeing, it's completely transformative. You deserve to feel seen, you deserve to feel safe, and you deserve to feel enough, but exactly as you are. Your story doesn't end here, it actually begins to evolve from here. You're not broken, you're brilliant in ways that the world just might not have caught up with yet.